Hello everybody and welcome to the Thursday edition of Video Clips. I missed talking to you on Tuesday this week, but I took a day off of doing broadcasts in recognition of the Memorial Day holiday. Even Dr. Pam needs some rest once in a while. All right, just a couple of things. First of all, remember the Diet and Lifestyle course starts next week. So doctors get 39 CMEs, nurses and dietitians 39 contact hours, and it is a remarkable opportunity to be on the phone live, teleconference calls with Dr. McDougall, Dr. Esselstyn, Dr. Barnard, Dr. Ralph Moss, our mental health guru, and all the other people you hear me talking about all the time. So you don't want to miss this. It's the place to be on Wednesday night. The other thing is next week, the next workshop that we're posting on the members site is Outdoor Fitness with Chris Dorcas. So Gary and Chris are filming a wonderful workout that you can take any place in the country when the weather's nice and it's starting to be beautiful. Everybody wants to spend more time outside. So all you got to do is go to the members site. We post every Wednesday. We're doing lots more programming this way, and people are really giving us great feedback on this. Okay, let's go on ahead and get started. I picked a couple topics to talk about, and we'll start with atrial fibrillation and how drugs can actually increase your risk of it. And I'll just start by saying that there's a mistaken assumption that drugs that are available over the counter, like non-steroidal anti-inflammatory drugs or NSAIDs, are safe, that there must be something better about them or they wouldn't be available over the counter. But I covered this in the advanced studies session when we were talking about Dr. Peter Gotchke's book, Deadly Medicines and Organized Crime. He says that NSAIDs are, quote, dangerous drugs and thousands of people are killed each year because of stomach ulcers and heart attacks. And then he goes on to describe how various NSAIDs have been taken off of the market because people died and that sort of thing. He says that during initial research, NSAIDs were shown to cause cancer in animals, and he doesn't think that this class of drugs should have even ever been approved. But they are, and you can buy them in any drugstore or grocery store, and lots of people take them all the time. So, to my point, this new study that I'm going to talk about shows that NSAIDs increase the risk of atrial fibrillation. Within only 2 to 4 weeks, a patient's risk increases 76%, and when compared to people who don't take these drugs. The researchers reported that the risk increases shortly after people begin the drugs. Now, atrial fibrillation has become more common, particularly in elderly people, but the age is starting to creep down. It's an arrhythmia that increases the risk of stroke and heart attack and can also increase all-cause mortality. So this is a fairly important issue, and NSAIDs may be contributing to it. The study included 8,423 participants. They were an average of 68.5 years old, most of them female. And data on drug use was taken from pharmacies. The subjects were categorized according to their length of use. Taking an NSAID for between 15 and 30 days significantly increased the risk for atrial fibrillation, and recent use in the past 30 days was associated with an even higher risk increase, 84% increase. The mechanism of action is not clear, but the researchers hypothesize that NSAIDs inhibit COX enzyme expression in the kidneys, which can cause fluid buildup and an increase in blood pressure. Additionally, NSAIDs are used to treat conditions related to inflammation and inflammatory conditions, and those underlying conditions may be partially responsible. So while people experience relief from their discomfort and pain, the underlying condition remains untreated. So this is another example of how treating symptoms and suppressing symptoms doesn't really help in terms of long-term health outcomes. Now, if you're wondering which drugs I'm talking about, the most common are drugs like Motrin, Advil, aspirin, acetaminophen, Tylenol. That's what we're talking about. And they can be helpful. They're okay occasionally for pain relief. But the problem is we've gotten into a whole population of people now who take these almost daily for pain suppression. And in fact, if you watch television, you'll see that that's the way that these are promoted. People who have chronic pain take these pills all day long, and they advertise some of them you only have to take it once in the morning. But these drugs have side effects, and the cause of the pain remains unresolved. People just get to pretend that they don't have a problem while their problem persists and gets worse. Now, another bad practice, in my opinion, I used to run marathons, haven't had time to do that lately, but I remember in the bag of goodies that they give you when you register for the marathon, there would be some NSAIDs, and the idea is to take those before you start the race. Terrible idea. You know why? Because runners often don't get the signal that something's wrong and they should either stop or do something different. And I know a number of people who've injured themselves in some type of competitive event because they just didn't get the warning sign by taking painkillers in advance that something was wrong. So the take-home point here is there's a time and a place to use drugs, and I would agree that sometimes these drugs are useful. The problem is they're overused, and the fact that you can just walk into any place and buy them doesn't mean that they're safe. You know, I've sent out a lot of broadcasts about aspirin, for example, that a lot of people assume the same thing about, and actually not true. All right. Let's move on to another topic, which is insomnia. Many people suffer from it. In fact, about 10% of Americans have chronic insomnia. And you have to give the drug companies a lot of credit. Boy, do they have good marketing people. You can't watch television for an hour without seeing one of these ads. You know, people sleeping peacefully and a butterfly coming in the room. And it just looks so wonderful. And they wake up in the morning refreshed. And it just looks fabulous. Well, the list of side effects, some of which are fairly serious and include a propensity to engage in activities like eating and driving a car while asleep, it doesn't seem to deter people from asking the doctors for their drugs. I mean, we're spending about $100 billion a year in this country on insomnia for doctor visits and drug treatment and that sort of thing. And I'm always kind of amazed when you watch these drug ads that they list all those side effects and people go, okay, give me some of that. I mean, it dissuades me from wanting to take them. But there are better options for insomnia. And in fact, cognitive behavioral therapy has been shown to be more effective in treating insomnia than drugs, even for people who have comorbidities like chronic pain or cancer. And it's significantly less expensive. Improvement is noted in just a couple sessions, and you can even do telephone follow-up as a way of keeping in touch. In a recent study, researchers reviewed the records of 84 patients who were treated for insomnia. And what these patients were offered was 6 weeks of classes, educational classes, in which sleep education, sleep hygiene, stimulus control therapy, sleep restriction, and relaxation exercises were discussed. The patients got a workbook, which is kind of customary with CBT. There's a lot of homework to do, and people essentially learn how to fix themselves. That's one of the things I love about CBT is it's an empowering thing. People learn how to do things for themselves instead of relying on drugs and practitioners. And it was proven to work in this study and others like it. CBT has been proven to work better than drugs, not only for insomnia, but for a whole lot of other things. Now, I just want to stop for a second, and this wasn't discussed in the article, but sleep restriction is where you only stay in the bed when you're sleeping. And if you wake up at 2 o'clock in the morning, you just get up and start your day and cycle through another day and go to bed, so you train yourself to sleep. It's a very effective method, and I have counseled many people on how to do it here. So I know this stuff works. I've had experience with it. All right, well, not only is CBT effective for sleep issues, but it's also very effective for ADHD, depression, anxiety, and even schizophrenia. Very low cost, very low recidivism rate, considerably safer, does not involve the use of drugs. And it's just unfortunate that it's not used more often. And I think the reason it's not used more often is the same reason that diet is not used more often. First of all, the stuff isn't taught in school. Passing references to diet are taught to doctors and nurses and other people, and passing references to CBT are taught to psychologists and psychiatrists, not really with any emphasis that this is a superior form of treating patients. And I think the other thing is that medicine in our country and in westernized society really places emphasis on expensive treatments and high-tech interventions, and that's how healthcare professionals are educated. And my gosh, the advertising campaigns are all directed at consumers to tell them how beneficial this stuff all is. So anyway, here's the bottom line. If you're having trouble sleeping at night, that is fixable. You don't need to be drugged up in order to fix it. So we can help you here at the Wellness Forum. We've done workshops on this, and it's something that I talk to people about. You can also contact a good CBT practitioner in your area, and that's a much better way to handle this than to drug yourself up and deal with all the side effects. I don't know about you, but the thought of driving a car while asleep concerns me just a tiny little bit, and even the smallest risk that might happen is a deterrent for me to ever take these drugs. The other thing I'll say, you know what helps for sleep? Exercise. Wear yourself out just a little bit during the day, and you'd be surprised how well you sleep at night. All right, well, that's all for today, all for this week. Next week, we'll have 2 broadcasts on Tuesday and Thursday. As usual, pass this on to anybody who you think might enjoy watching it. Have a great day and a great weekend.